In this video lesson, we'll be covering a nurse care plan for the nursing diagnosis of activity intolerance. This is a crucial topic for providing holistic patient care, especially for those recovering from illness or surgery. We'll cover its definition, defining characteristics, related factors, expected outcomes, ongoing assessments, and therapeutic interventions. By the end of this session, you'll have a clear framework for managing acute pain in pulmonary patients. Now, let's begin. Activity intolerance is defined as a state in which an individual has insufficient physiological or psychological energy to endure or complete necessary or desired daily activities. This diagnosis is often temporary and arises due to various medical conditions or treatments. Defining characteristics. The following are common defining characteristics of activity intolerance: verbal reports of fatigue or weakness, abnormal heart rate or blood pressure response to activity, dyspnea or shortness of breath with minimal exertion, generalized physical discomfort, or inability to perform activities of daily living. These indicators suggest the patient's body isn't tolerating activity levels within normal limits. Related factors. Understanding the underlying causes is essential for targeted interventions. Common related factors include the following: physiological factors, such as conditions like anemia, heart failure, or respiratory disorders; immobility or deconditioning, which can result from prolonged bed rest or a sedentary lifestyle; psychological factors, including depression or lack of motivation; and lastly, treatment effects, like the side effects of medications, such as beta blockers or chemotherapy. Assessment focus. When caring for patients with activity intolerance, assessments should be thorough and ongoing. Focus on these main factors: cardiopulmonary status, where you assess heart rate, rhythm, and respiratory rate pre- and post-activity; muscle strength and endurance to evaluate the patient's ability to perform basic activities; psychosocial factors, to determine if anxiety or depression is contributing; and environmental factors to assess for barriers like lack of assistive devices or cluttered spaces. Expected outcomes. By the end of your nursing interventions, expected outcomes should include: the patient demonstrates improved tolerance for physical activity as evidenced by completing basic ADLs without excessive fatigue or dyspnea. Vital signs remain within acceptable parameters during activity. The patient expresses confidence in gradually increasing activity levels. Ongoing assessment, nursing actions, and rationales. Action: monitor vital signs before, during, and after activity. Rationale: changes in heart rate, blood pressure, and respiratory rate provide insight into the patient's physiological response to activity and guide adjustments to activity levels. Action: assess the patient's reported fatigue level using a standardized scale, for example, 1 to 10. Rationale: self-reported fatigue helps identify subjective limitations and customize interventions. Action: observe signs of intolerance such as cyanosis, pallor, or excessive sweating. Rationale: these are indicators of inadequate oxygenation or poor perfusion during activity, requiring immediate intervention. Therapeutic interventions. Nursing actions and rationales. Action: turn and reposition patient at least every 2 hours. Establish a turning schedule for the dependent patient. Post the schedule at bedside and monitor frequently. Rationale: turning and positioning prevent skin breakdown, improve lung expansion, and prevent atelectasis. Action: maintain proper body alignment at all times. Rationale: to avoid contractures and maintain optimal musculoskeletal balance and physiological function. Action: provide education about energy conservation techniques such as sitting while performing ADLs or delegating tasks when possible. Rationale: teaching patients how to conserve energy helps them optimize their functional abilities without undue fatigue. Action: have the patient perform ADLs. Begin slowly and increase daily as tolerated. Rationale: performing ADLs will assist the patient to regain independence and enhance self-esteem. Activity intolerance is a common nursing diagnosis with significant implications for patient care. By thoroughly assessing the patient's capabilities and implementing tailored interventions, we can improve their tolerance for activity, promote recovery, and enhance their overall quality of life. Well, that ends this video. If you found this episode helpful, don't forget to like, share, and subscribe for more nursing care plans and study tools. Until next time.